Yeah. Hello and good evening to one and all. It is the 10th of January. So here's wishing you all a very, very happy new year because this is my podcast for the first time in 2026. And like 10th of every month, as the chairperson Imaging Science Committee, I come back with yet another podcast. Perhaps this would be the last for the year 2025-26 under the able and brilliant leadership of my dear friend Dr. Sunita Tandulwadkar. I now take the opportunity to welcome our president of the Fogsi, Dr. Sunita Tandulwadkar, under whose leadership we have gone past the numbers and we are coming close to 365 podcasts that we've done. And I have the privilege to be working under her as a chairperson, getting the guidance from a brilliant leader and and a person and a friend par excellence. So, Sunita, welcome to our show.
Thank you, Nina. Thank you. Thank you so much. And it's a brilliant that you are starting and ending with the dignitary saying, and you would like to continue your podcast in that way. You have always chosen the topic of academics, and I think your podcasts were highly, highly valued and viewed because of its high academic content. Uh, Professor Karunakaran, it's a huge thing, 345, if I say more precisely, and 46 today. And every day, 8 p.m., my committee chairpersons have done a huge work. This was the only flagship program which was completely dependent on chairperson. And believe me, they were excellent. I don't have the word or adjective for them. None of them have cancer. None of them have interchange. Everyone, like Nina, on 10th of every month, she knows it is her podcast. She will not go anywhere. She will not take any other dinner or social commitments. So that's brilliant, Nina, and every chairperson. I really, last 1 week, I'm just thanking each and every one of them. You are one of the lucky who is seeing 2026 also, because on 14 January we are ending it, and 15 January we'll be handing over at 5 p.m. Otherwise, we would have finished even on 15th one podcast. I'm so glad to have you. I joined just to welcome you and to show it respect for your time and value you are giving to Foxy. Thank you so much, Nina. I'm sure this will be one of the best podcasts. And I will be joining the viewers link to enjoy the scientific dialogue between both of you.
Thank you, Sunita. Thank you so much. It's been an honor and pleasure to have worked through these podcasts and many more events under your leadership. Thank you once again for guiding.
Thank you.
So, friends, I think we've come a full circle, as I would say. I began my podcast in the month of February with none other than Dr. Karnakar Marikanti, and I think we are back to the last podcast of this academic year, again with the same celebrated speaker and my guest. Welcome, Dr. Karnakar. I hope you don't mind if I address you as Dr. Karnakar or Karnakar as I do it. So, to my dear viewers, I would just give you a brief background of Dr. Karnakar. Dr. Karnakar Marikinti is a qualified reproductive endocrinologist and fertility specialist and an obstetrician gynecologist who began his career from the All India Institute of Medical Sciences, completing his 6 year residency when he moved to the UK in 1992. He worked at some of the most brilliant units and centers across the UK. First worked at the Bourne Clinic, which gave the world's first IVF baby, and then he strengthened and protocolized the hysteroscopic services at the unit. Having done his stint at the Bonehole, he moved to the St. Mary's Hospital in London, where he completed his CCST in as a reproductive medicine specialist. He worked a long way with brilliant teachers and leaders, some of the experts and pioneers in the recurrent miscarriage clinics, where he completed his fellowship and then didn't stop. He worked at the Care Fertility in the UK, which is one of the leaders with the highest pregnancy and implantation rates. He moved to the UAE, where he's currently based in Dubai at the Millennium IVF Center. He's an accredited trainer in ultrasound and ISWOG, which is the International Society of Ultrasound and Obstetrics and Gynecology. He is a trainer who does training courses across the globe, not only in ultrasound, but also in ART techniques. And he's a very, very accessible, available, and a very, very friendly person. And he can put it to record that whenever I asked him, I've never heard a no from him. So thank you, Karnakar, for joining in. And as we've chosen a topic which may be a little offbeat, we talk of mind and fertility. So welcome, Dr. Karnakar, to this show again.
Thank you.
So it won't take much time, and I think we'll start it as soon as a woman conceives or there is a blastocyst which latches onto the endometrium and grows on to become a baby or a fetus. I think we see there is an evolution. There is development of the organs. There'll be cardiac activity appearing at 6 weeks, and then the fetal brain developing, then the fetal, heart organizing, the kidneys, the liver, so on and so forth. The brain developing. So I think there is a process of organogenesis as we've learned, and we've understood by the book of embryology and how we see on the ultrasound. I would say, and I would shoot my first question in that momentum to say, do you think the mind develops in some way in utero, or is it something as a human being evolved? Because we know there is an in utero development of organs, but is there a scope to say yes, there is an in utero development of the mind? Because today we are talking of mind and fertility. So I thought, let's begin with where do we see mind developing?
This is addressed by none other than Professor Kypros Nicolaides, and he was almost vehemently clear around 20 weeks onwards. There is response for a specific signals, not just the brain as a reflex, but as a mind. So I would say it's almost from the 5th month of fetal life, there was some recorded evidence of mental development happening.
So thank you so much for telling us that yes, there is mental development and there is something which we call as mind, or we'll move further and talk about the later part of mind controlling us or we controlling our minds. So as we look at human reproduction, both in men and women, do you think mind has a control or it controls reproduction in women? Or how does it play about in governing the HPO axis or whatever bits of reproduction we understand today?
The brain literally is responsible for physiology, and the mind is responsible for psychology. So brain automatically has the natural tendency to procreate, like all the animals do. So vast majority of the procreative endocrinology, neuroendocrinology is operated even in the absence of mental capacity. So we know that very well. There are people getting pregnant even in unconscious states, myasthenia gravis, and the worst ARDS, worst conditions of living in many countries. Mentally, they are not at all ready, but the physiological, the biological, the instinctual operating system to procreate seems to be much, much stronger than it is not. But it is once the evolution starts, the mind can literally switch off the reproductive system, and it can speed up the reproductive system, and it can actually strongly affect the reproductive system, so to say that. But the instinctual reproductive biological capacity to procreate is largely unaffected in majority of the people by mind.
So I think then let's look at how we seeing that when we say, oh, there is a mind controlling, and now that we see that there is an evolution in the way we have evolved as human beings, and in the last few decades we're moving with a lot of aggressive lifestyles. We look at our evolving lifestyles and the socioeconomic development and upliftment that we see. Do you think somewhere mind is controlling reproduction? I.e., if you look at the stress that is of late seen among women who are chasing careers as well as chasing their balancing out of their home fronts. So, where would you see the mind coming in play, or do you think it is one of the factors that could be attributes to human reproduction?
The well-established demographic data, the industrial revolution that happened gradually over centuries has affected fertility. Unquestionably, that is related to effect of industrialization on mind, which affects the biology. So if you take one data from France also, within 17 years, there is a 30% drop in the sperm quality, and largely it is attributed to the cycling. that increases the scrotal temperature. So I can just give an example. There's no question. There are multiple 360 directions. The industrialization affected the instinctual biological reproductive capacity that used to last several children in per family has brought it down. And classic example is the rice eating industrialization that happened in the last 300 to 400 years. Mass production of food. Polycystic ovaries almost universal. Diabetes is almost pandemic in these countries. And insulin resistance will affect fertility. So there's no question. When the insecurity of the food scarcity industrialization happened, the reproductive system is grossly affected. So we know very well that eventually a lot of men are going to need ICSI to become fathers. That is the data that is coming from the France. So no question, the original great-grandparents' Stone Age reproductive function is no longer relevant. That statistics, that data is no longer applicable for the modern system. So now people come, I have PCOS. Within 6 months, I don't have period. Stress, they don't have periods. Sports, they don't have periods. A-level exams, they don't have periods. Circus artists, ballet dancers, where they invest very heavily in the physicality, they won't have periods for years. So no question, the lifestyle and the modern needs of living conditions strongly affects fertility, because fertility is not a glucocorticoid pathway or mineralocorticoid pathway. It is the third priority of the hypothalamus and pituitary axis, which is the word that you used. So priority of reproduction is C, or the third or fourth priority. Achievement, success, go and get, these things will supersede any fertility needs. That's, we are all obviously seeing endless examples.
So we can say that we are the victims of our own success. If we are seeing rising infertility, I think as a human race, we are the culprits, and we may simply put it that we are responsible for this. Do you
Yes,
think that is?
largely the fertility cycles that you're seeing, people more proliferating fertility centers in the world, are largely negligence of the teenage health, negligence of the reproductive health, or lack of information. There are multifactorial reasons why we are not giving, protecting the reproductive health our grandparents had. Absolutely fact.
Is it because our great grandparents did not face the so-called stress of modernity of the modern day living as we are facing? So simply to say is, in other words,
Yes, their food, Stone Age diets and Mediterranean diet, these are the best known diets to prevent obesity, to prevent insulin resistance, and that affects the gut health. The fermented food was not just a deliberate thing. They were not using probiotics, prebiotics. The food was fermented because there was no fridge. So fermented food is the highest prebiotic and biotics that we have to keep the gut health. And gut health affects the immune system. Immune system affects the endocrine system. So the gut neuroendocrinology is one of the causes behind the polycystic ovaries, which is a leading cause of infertility in rice eating and wheat eating countries.
so let's talk about the adolescent and the teenagers. So as you really touched upon, there is now a growing evidence and there's a growing body which says the gut-brain axis. And of course, as you point out, could you really dwell on how do you see the gut-brain axis affecting, if not, of course, we do say teenagers putting on more weight, sedentary lifestyle, but do you think that could be playing a role in controlling the evolution of diseases beyond PCOS? I mean, endometriosis, adenomyosis that we're seeing on the rise in women.
The best of the scientists on YouTube, they're gone on public or on record to say the gut health is dictating 70% of the pathologies of the human race in the last 100 years. So, and endless videos on YouTube, anyone can see they're masters in their field. They're credible research think tank people, the biochemistry of the gut and the bioendocrinology of the gut, which has the roots of lymphatic system. And that leads to maturation of the T regulatory cells in the thymus, and the roots are from the lymphatic system. So if the regulatory immune system is affected, almost all the autoimmune conditions becomes dominant. So we see the premature ovarian failure. We see that many conditions are due to lack of proper gut health, and that includes reproductive health. So that's why
Absolutely.
any research centers, if you go for recurrent miscarriage, implantation failure, the first thing there is how with nutrition and good eating habit, good lifestyle, you can improve the gut health and the immune system, the next crop to come a better immune cells rather than giving immune suppression medication. So we want to make happy immune system by happy gut.
So I think we have to say that the wisdom comes from our Vedas, where our Rishi Munis really believed that everything begins with the gut. If you have a healthy gut, you will be healthy mentally, you will be healthy physically. So I think we are needing knowledge coming from the West to tell us what we actually knew many, many 100,000 years ago. Am I right, Dr. Karnakar?
The all the Eastern educational institutes, the Guru Sishya Parampara, all of them given highest priority to grow their fruits and vegetables to eat in the same school. There is no food from supermarket ever was there when these people lived up to 80 to 100 years with the best of their health, best smile, best radiance in their eyes, best skin conditions, and most peaceful people ever were there, our ancestors. So there is no question going back on. These people ate what came from the earth directly, not stored food, not frozen food. There were times where in NHS UK, I was eating 2-year-old biryani. That was the only food that was available as a night duty SPR in London. And that is even educated people, well, in a position to discriminately use good food and not helplessly eating frozen foods and foods with a lot of preservatives that affects gut health. If even 5% disturbance in the gut bacterium colony can cause severe autoimmune dysfunctions for even 5% drop in the gut bacterium.
And now we are actually looking at gut microbiome as a root cause to find the etiology of these diseases as we have evolved, I would say, in our economic evolution. We have brought this disease. So I would say that we are lying to learn what our ancestors taught us many, many years in ahead. So just talking about food and the brain gut axis, there's another thought that comes to our mind, and that is what I would say mind. In these days, I would say the millennials or the ZZs who believe in working long hours, it's somewhere to say the sleep cycle, who we believe getting up early to bed and early to rise is how our generation grew up. I think it's a reverse what's happening in this generation. You see that they have late nights, they work odd hours, their sleep cycles are disturbed. And of course, thanks to the available, I would call it a necessary evil of the mobile phones, the use of so much of technology. Do you somewhere see sleep playing a role in controlling reproduction both for men and women?
I recently had two presentations on immune system in reproductive health and genetics in male infertility, female infertility. That brings to that I have to review how sleep over the generations has prevented evolution of the reproductive system to its full potential. Not only just reproductive, because we are only having a conversation on the reproductive health, not other healths, but it affects in multiple ways. They are not prepared to handle good eating, then therefore good advice at the right age from the right experts, none of them, because sleep disturbances, whether it is due to money earning requirement or they can't sleep anymore because of the high adrenaline lifestyle that is built, high demanding lifestyle. Sleep disturbances causes severe immune dysfunction related miscarriages, implantation failure, and of course it's part of many reproductive health conditions. Pelvic pain, endometriosis has a sleep disturbance. Pelvic pain has sleep disturbance. Azoospermia, this man is not sleeping. And it's vicious cycle. Sexual dysfunction largely have a sleep disorders. So in the references that I was doing based on the podcast, we thought of the topic. I reviewed 2015 ESHRI guidelines on this topic of how you manage the mental health before you groom them into technical side of the ART treatments. It's a saga of 160 pages recommendation by 22 experts all over the world, and sleep is a section there. So we are very much conscious. A bad sleep will create a bad following day, and that affects neuroendocrinology, which is directly responsible for hypothalamo pituitary ovarian uterine axis.
Thank you. I think you really drawn our attention to the ESHRI guidelines, and you rightfully said that as clinicians, we are talking about the biology, and we talk about how to circumvent, perhaps give them ovulation support, give them, drugs to improve endometrium, maybe do IVF, ICSI. But the bottom line is spending and giving them time to tell them that this aspect is important, not just the biological treatments that we do, but on the diet, on their happiness, and also on the quotient of sleep, which is paramount to them. So, having understood, and I think as we would say that, do you master your mind or the mind masters you? I think let's say you master your mind. So, how would you think that is there a place to circumvent with the guidelines that you've read? Could you enlighten us? How should we counsel? Because all of us are busy. There is paucity of time in our busy clinics, and the demanding patients who want success in the first visit. A fast track baby vending machine is what they think us. Where do you think is the proportion that we should spend on talking beyond talking of their IVF ICSI cycles? Where would you put the stress, and how would you begin their journey to
Yeah.
circumvent all these challenges?
Yeah. So there is a tool. It's called a screen IVF tool, which gives scales how to measure who needs actual psychotherapy, who needs psychiatrist consultation, who needs mood consultation, who needs interpersonal relationship counseling. So there is a tool, Screen IVF, which is recommended by ESHRI guidelines in 2015. So I'll just give only one example. But then you can always, any sensitive staff can identify who just doesn't need a technical IVF, but they need much before that. So they have given exhaustive 160 page on which there are 22 recommendations were made. But if we want to make an essence, there is no question. We have around 22 scales, of which 6 of them are dedicated fertility quality of life scales. So how they see themselves as infertility, some people don't care about infertility. Because I lived in Europe, I can say same-sex couples, single women, and who are married before, and then they become single, and then they go for lesbian. So I've seen a lot of people, childlessness is not a big concern. So you need to identify who is actually require dedicated mental health management prior to giving the technical side or endocrine side or the medical side or the surgical side of reproductive health help. So there are screening tests. They identify them who needs a top priority, who must fix their mind before they come for fertility treatment. There are some people, they handle even 5 IVF failure better than the doctor. And I'm sure in your experience you have seen.
Absolutely. So I think I would say that at the end of the day, it's your patients who are your teachers, who at times teach you how to manage and you learn. So having said that, and since you've got an experience working in the UK, working in UAE, and of course in India, so by the guidelines, and if I would say everybody has now recommended, including the guidelines in India, that every IVF unit should have a counselor. But then there are situations, particularly in the less privileged, clinics, where everybody may not have a counselor, may not have the access, or every patient or every couple may not have an access to a good psychologist. So do you think, as individuals, as clinicians, should we also master the art of doing some kind of hand holding and talking to them, understanding their psychology, or just leave it to, yeah, you go to a psychiatrist because this screen test says so, or this, app that I've used fits you into? How would you take that kind of, and what is your perception on handling like
I
this?
started Wellness of Women London company with this because I believe in wellness, keeping myself physically, mentally, emotionally, spiritually fit for the last 30 years. So I take huge responsibility and huge satisfaction in identifying, are they willing to handle the journey of how they see their infertility, how much they want to go, how far in financially, emotionally, to hone hand holding. And if it doesn't work, particularly come with the red prognosis patients and amber prognosis, it's too far for them, too much, too hard, too limited resources. So depending on the background profile of the couple and how much they're actually geared up, I will titrate my own contribution to them. I give references on mental health. I give yoga videos, pranayama videos. I demonstrate them. Even in the new one of the project that I'm doing, I have a yoga mental health room in every IVF clinic. And you know that very well in UK, there's no license ever given without appointing a non-directional third-party counselor. No IVF license is ever given. It is not financial counseling, which I've seen in some third world countries. It's financial counseling. People are calling counseling. No, the counselor should not be part of the healthcare provider nor belong to the healthcare recipient. It should be third party, non-directional counseling. So yes, by law, it is required. Secondly, if you are a beautiful minded doctor, you should be the first person to take the load because for whatever reason, most patients have a lot of faith in doctors more than a psychology people, psychiatry people, because I mean, I have seen in my personal experience, if you understood the couple better, you are the best counselor. You know the sisters of the victim of infertility, the mother, the uncle, the aunt, the friend, the colleague. I have seen beautifully minded people reducing the pain and suffering of infertility or failed infertility treatments much more potently than a typical qualified doctor who never experienced infertility, who never experienced himself any loss of miscarriage, who never experienced IVF failure, cannot, I mean, less likely to be empathetic. Without empathy, there is no compassion. And these are the two things, two legs for an infertile journey of any couple.
I think you brilliantly put it. Empathy and compassion. And I think that's what we all have to learn. It's not the science, it's the art. So I think you have to really spend time with your couples, understand them, know them better, and then handhold them rather than just talk off the statistics on the percentages or the success story. And I think what matters is how you kind of indulge and involve yourself. And now I know that you've had vast experience. Somewhere in controlling the mind, I think there is a very big interplay between our mind, our thoughts. And I know that there is so much of negativity and pessimism that is around the whole ostracized society when women are infertile, or for that matter, couples are infertile. Where do you think comes the play of spirituality? And of course, coming from an Indian background who practices Upanishads and who has such a strong belief in the value system. Dr. Karnakar, where do you would put and where would the pendulum stop on spirituality in your practice? And how would you say about the same?
Beautiful mindedness is spirituality. It takes an effort to understand. We are originally beautiful people as children. Unless pollution happens, the child remains sane. So, becoming an adult is actually considered as adulteration, which means the covering the beauty side of you with less beautiful layers of fear of other person, fear of failure, fear of insecurity, because you get programmed, we get conditioned. All the greatest spiritual leaders, like you can take Jyoti Krishnamurti, Osho, people who read yogas, Vedas so deeply, living in forests alone, they say only one thing: be a child and you understand everyone around you as good as. So it's as an adult, as an IVF doctors, we cannot be like a children. But being beautiful within will always brings beauty out of you. Being beautiful is spirituality. Every Vedas, every religion, what they taught is see the kindness that which your mother reared you, or your parents reared you, your people reared you, your community reared, and you only take it to the next person who looks up to you for mental health issue, whether it is infertility linked or not. So for me, every culture, every religion taught only being lovable is the fundamental human uh, trait we all have. And only when you fear something is going to go wrong, you heard it, or you have a bad experience once before, you project previous pain into fear of the future. So once we understand this psychodynamics of mental evolution as an adult, we failed in exam, career, we bring all of them into no, we have to secure future. So people are security driven rather than love driven. So it is something that every religion has taught. The kindness the mother gives is your first and best source of how to give the kindness you received from your mother. Most mothers don't ask anything from growing children, even if they kick, if they throw tantrums in a shopping mall and they walk away from shouting at parents. Mother looks with kindness. And if you develop that attitude as a doctor with kindness, there is no better spirituality rather than maintaining that parental tendency towards a child who is doing things wrong or who is not mature enough. So the couple have less knowledge. Couple are less knowledgeable than the doctor. So you need to convert your knowledge into kindness. You should have the tolerance in your ears, kindness on your tongue, and sympathy in your eyes. There's nothing about spiritual. This is spirituality. Being clear
Absolutely.
headed is a spirituality. You explain to the patient, you have a red profile condition. IVF don't work. Say that. That is spiritual attitude. You don't really take them for a ride. If the pathology is bad, the couple expect us to give the true, honest diagnosis. We are not investing enough time for a diagnosis contributed by psychology, contributed by emotional disturbance, contributed by cognition disorders. We are not actually validating which aspect of them we are treating. We are only treating ovary, ovulation induction, tubal surgery, endometriosis, chop them off. So we are looking at pathology rather than the human as a total. So any doctor who has an attitude towards the couple sitting holistic approach to them and present himself as a complete person, giving total attention to the patient's psychological needs, emotional needs, relationship needs, cognitive needs, financial needs, then you are coming back. So we should not treat them as customer. I think that's where I can definitely add on. There is a lot of commercialization of the healthcare. That's why people are looking on Google, are going everywhere, and they lost faith in the temples also, because they know it's not going. Temple is not going to give. An IVF doctor is going to give a baby. So we lost this concepts of religion. We lost concepts of not respecting our parents or getting the beautiful side of our parents. There are a lot of things. It's going on for centuries. Throughout your evolution, you are not seeing the beauty of the human side. You are seeing the hurried side of a human side. So it's a fast-paced culture. That's where you're losing importance of the spirituality. Spirituality is not the fitness of mind, physical well-being, mental well-being, emotional well-being, being lovable. People will notice if you are lovable or not. If you're a lovable doctor, you can impact that with your entire infertility clinic.
I think it's beautifully. I think in the last couple of minutes, you've covered the 360 aspect of spirituality, and I think spirituality means being beautiful, and as you rightly said, be motherly. A mother who gives unconditional love to her children, how many they are. I think that's what we have to imbibe in our hurried society, in our culture. And rightfully said, I think today, more than Dr. Google, there is a chat GPT where patients would be more knowledgeable than what we actually know, but then winning their trust through honest opinions. And I think honesty is what I think is the crux. And I think it's a bottom line for us to realize that we can make a difference to our patients. But then I'm sure in your experience, and I'm sure you have anecdotes, and that's what I want you to share, that we have seen patients who are in the red zone, in the amber zone, somewhere we are spiritual, but they come and tell you and surprise you and give you surprises that they had a miracle baby, as we'd call it. Do you think somewhere it's the spiritual side of the couple that helps them conceive despite all the odds against them? Or you feel, yes, it is your medicines that worked?
I am a pranayama practitioner. I can reduce the blood pressure of my antenatal case or somebody with a borderline blood pressure with breathing through left nostril, which will stimulate the vagus nerve. So, scientifically, there are so many yoga institutes across the globe which can drop your autonomic nervous system related impact on the endocrinology as well as psychology as the mood disorders by just doing proper self understanding of the your ability to control the mind. You ask me this question, mind controls you or you control the mind. So either you enslave yourself to the mind, automatically you listen to whatever you get it, you go with autonomic service system, or you can control autonomic service system. There are endless references to say, yes, you can control the mind, no question about it. But that's, you require some good mentor who they're called acharyas in Sanskrit, somebody who practices, who radiates the beautifulness of calmness can pass on to you. But who is neurotic psychiatrist or a counselor or a psychotherapist, you're not going to get anything from them. So selecting your guru or a mentor or somebody who's going to empathize with you is important. At least we need to look for a better person to work with, get the help from. So there's no question the practice of all the traditional complementary accomplished science. Nobody disputes the greatness of living in tranquil moods. That has effect. It will take your fertility longer, your miscarriage rates are lower, your immune diseases are lower, and you can reduce your blood pressure. There are people who stop even insulin for diabetes. So no question, properly trained complementary medicine experts has to part of the role. We all know even oncology, many branches, complementary medicine. You go to UK, you have Homeopathy Institute next to Great Ormond Street Hospital for Children. It's as big as that. It's part of NHS. So no developed country is turning away the traditional medicine which works with the roots and herbs that come from nature. Panchabhutas, we call them. The five elements which made us has the strongest control than whatever your mind, which is a conditioned, programmed, outcomes that you are demonstrating. We're all programmed. Memory, imagination, neurobiology determines your mind performance. MIND.
Thank you so much for giving this acronym in such a beautiful way. So, I know that there are times when our patients come and say, "Oh, I went to a spiritual leader and I got a pregnancy. I went and did seva in some ashram and came back with a baby, or I was cured of a disease." So, do you think somewhere it's not the biology or their mindfulness that helped them, or you think, no, it is our
Many
perception or their
irregular cycles, abnormal bleeding clinics, polycystic ovary people, the motivation that comes to them will help them to be better lifestyle. So it is the sweetness that they feel, they treat themselves, require help, and they know how to connect with them. There is a self connection. So all this helps make you self connected. A self connection gives you the highest quantity of motivation. Once you are motivated, nothing stops you from losing BMI, from get a regularizing the cycle. I'm sure you know BMI normalization brings 30% of pregnancies. It's as
but you
simple
need a
as that.
but you need a motivation to lose your weight and
Motivation that comes
motivation.
from self belief, and you need to see the acquirability of such motivation in person in front of you. For that, you need to have a connectivity. Connection is yoga. That's why these words cannot be removed. Connection is the sweet form of connection. A connection that stays is yoga.
Thank you so much for talking in depth. Now, I think when we are talking, and I would want to know, you're a busy practitioner who has patients across, from all parts of the world where you see them in UAE, you go back to Cambridge and you see all kind of different patients. When you talk to these couples, how much of your time would you devote in your practice? If you say, yeah, you to see a couple, and in the NHS, yeah, you give half an hour or maybe 45 minutes to your first consultant, 25 to 30 minutes to your second consult, how much of it would be just talking about their biology or the disease, and how much would you say I would talk about, or you say, no, I'm a busy doctor and I feel, how would you play around with your, consults, and you see that one size does not fit all, or how would you give us an advice in talking to such couples?
Yeah, so as an experienced clinician, you yourself will know there are our elders, our seniors, we know common seniors we both have. They only for teaching purposes they were there. But if they have a choice in a private practice, what I've noticed is they give as much as the couple requires, as much as the time that is required. That's what we do to our children. We don't tell them, I'm going to hug you only in the morning, I'm not going to hug in the evening. The minute you see a hug will help, you're going to give a hug. Again, I go back to the maternal attitude towards everything what you do in life. There's nothing sweeter than being a mother. I can admit. So what I'm trying to say, there are people in UK, when I book a recurrent miscarriage consultation, we give 90 minutes consultation. Now in USA, in the preventmiscarriage.com Harvard unit, there are only 3 consultations for recurrent miscarriage booked for the whole day. Only 3. So what I'm trying to say, you charge more, but you give the quality and quantity of time as required, as judged by the couple. See, these S3 guidelines, honestly, everyone who is listening here must look at how do you assess the mental needs of people sitting in front of you, whether they came to do your residency, whether they came for a parenthood, it makes no difference. They look up to you. They surrender to you to give them what they want, but you need to judge. Some people understand very quickly. They say, okay, do this thing. They just trust you. They do whatever you want. They're just executors. But some people, without connecting with you, they go to 110 different doctors. So establishing a beautiful rapport may take 90 minutes. It may take Zoom meeting freely. I don't wear watch for nearly 20 years now. I give infinite amount of time. I do Zoom consultations morning 6 to night, mid 12 night. I'm not boasting. This is me. I learned it that once you connect with them, next procedure, you don't need to spend a lot of time. Once they connect like a child with you. Doctor-patient relationship is mother-to-child relationship, and it lasts for decades. I'm sure you know.
And that's the reason why I chose you as my guest for this
I
theme of
love, I
mine.
love what I'm doing. It's just like
And
I'm
that's what
born
I
to
wanted
be
you. That's why I wanted you
Vaidyanarayana
to be in.
Hari. Vaidyanarayana Hari. I see God in being a doctor, or I don't pretend doctor, but I work like a good farmer. I love to give the such examples. I want to understand the plant, which is embryo. I want to study the what quality of soil you have, and I want to work very hard to grow a crop. Nobody ever failed to get that straight. This guy makes sense to me. I know what is farmer. I know what is cooking. Let's work with this guy. It doesn't mean he guarantees some good crop, but he's understanding how a good crop will come. Let's go with this guy.
So to my viewers, I must share that Dr. Karnakar is well known not just for his clinical knowledge, but he adds the charm to his patients by giving them the time. His devotion comes so promptly to him, and I think that's the way you learn to realize that he's a person beyond books. He's a person beyond the journals, and he's a person who knows so much of Upanishads, so much of knowledge that comes. And I think I'm very, very happy and satisfied that I got and I managed to get you for my podcast. So,
Can I add
having
one
said,
line at the Upanishads? There are 108 Upanishads available, and the reason is there are 108 different type of people as couples sitting in front of you. They have 108 different needs. You cannot put one shoe fits all. So Upanishads are nothing but giving mental clarity to the people who are not clear in their mind by somebody who is clear-headed. So 108 varieties problems can be there. There is 108 variety solutions. Again, solution is a clarity. So it is the way you give analogy and metaphor can change, but the material is same. I give you clarity. I'm sorry, science cannot help you. Your endometrium is so badly damaged and surrogacy is so costly. You explain that in 1 10 seconds, but they need to feel that you're objectively, scientifically showing that uterus is so badly damaged it cannot be repaired unless it's a uterine transplant. I tell everything possible. I want to be the interface between science and the couple without money coming to play. And that's what I can say. If we don't charge most infertile couple spending quality time with you, they accept their childlessness, lack of parent opportunity, failed ovary, failed uterus, azoospermia. They're willing to accept leaving responsibility to nature or God, whatever they have faith in, but they don't feel blame themselves. I don't even know the reason for infertility. I don't have a child. No doctor is helping me. Unexplained infertility, unexplained miscarriages. This is where the guilt, the hurt destroys more than the infertility. I'm sorry, I have to talk more than what you asked me, but Upanishads are nothing but giving clarity. There is no other better way of saying Upanishad. They are not asking you to pray God. There is no God in Upanishad. There is no word God in Upanishad.
thank you so much for enlightening us, and that's what I wanted. You have to be clear minded, you have to be focused before you can. Your enlightenment level has to be beyond the books, beyond, as I said, and that's where you need to be a happy doctor. I think we've been enjoying this journey of talking on mind and fertility, and I think we can go on with your wisdom that you are sharing with us. But I think it's no, we've spent more than nearly 45 minutes talking, but I think before we can wind up and say, um, how would you sort of, we have a whole cohort and a whole crop of you youngsters who look up to you, to leaders like you. How would you kind of, give some pearls of wisdom to the younger generation who is really excited to take up reproductive medicine? Where do you see in their journey in career? Yeah, I know our generations, we were fortunate to have, leaders and teachers, truly, as you said, who gave us this wisdom. Where do you see when there is so much of excitement with the, that readiness and that hurriedness in everything that you see around? How would you sort of guide them and give them your advice on their training, schedules and training programs?
Yeah, so a simple English proverb I can say, or a Sanskrit sentence I can say, or combine both of them. So you can become an unsinking ship, but you cannot change the tides of the sea. So build yourself as a strong ship so that you can face any tides in the life. So we need to nurture good eating habits, good talking habits, good sleep habits to our youngest who are dependent on us. And the school teachers should be so healthy, they pass on health, physical, mental, emotional health in the formative years. Then in the teenage, we need to screen for major problems of fertility from the teenage. PCO starts in the teenage. Once we address that, when we say insulin resistance is going to keep you as a risk patient for endometrial cancer. So healthy parents with healthy mental strength can rear next generation better. Same healthy teachers in the school, which health should be part of curriculum. Mental health, complementary medicine, yoga, meditation, whichever a good teacher can pass on martial arts to a child. A good teacher can pass on music learning interest to a teacher. I think the grown up, so-called lucky people is an advantage, which is a teacher, the doctor, mother, father, who are in an advantage than a child, next generation. We need to be standing as an examples. And it is not rocket science. Our great grandparents were playing with us. Our grandparents were playing. They didn't ask for money. They lived with us until we go to school, college. They drop and see, they're waiting for you to receive. I think we need to emit life, emit love towards anything what we do. So with love, you do anything, only lovable society will form.
I think it's been a wonderful time that we spent with you, Dr. Karnakar, today. And I think you really enlightened. So I think a word of wisdom that comes, I think, chase your dreams, but chase them with happiness. Chase them with faith that you can overcome whatever obstacles you see. And I think,
With
as you rightly say,
satisfaction, not for satisfaction. Become a reproductive health career person. I'm more than happy to keep my number, email. Anybody can contact. How to become a great embryologist. Again, a credible, authentic, a beautiful embryologist where people want to come and learn, practice embryology in the correct way. Same reproductive endocrinology. I've been using Spiroff as my pillow or my handbook for last 40 years. I can't stop loving that book. So since I've digested it, and I've been running training programs, close to 5,000 doctors I've trained. Everyone who is listening to this is more than happy to connect with me for career in reproductive health. And it's beautiful to create because it lasts longer. Your contribution is standing in front of you like a big oak tree, or a university you made like Nalanda University, which is the oldest university, or the spaceship you made, the internet satellite launch we have done from Sriharikota. We look up to these people who are making us our lives happy. Let us create something. Let us not just users of the previous generation's great love and work towards science. These are the people who did everything with love. That's why he invented things. For love, you cannot achieve anything beautiful. With love, you can only achieve love from anyone around you.
how beautifully said. Thank you, Dr. Karnakar. And I think we will be ending up this show by thanking Dr. Karnakar and to all our viewers. It's his generosity and magnanimity to say that he's available and he is accessible. You just have to Google Dr. Karnakar Marikanti and you will get his email, you will get his phone contact. And we wish you all the success. And we would want teachers like you to train the youngsters, to share knowledge and be happy as I can see the radiance that shines around you. And thank you so much, Dr. Nakar, for being the guest today for our show. Thank you once again.
Without you inviting, I did not have opportunity. I thank you for that. And Dr. Sunita also. Pranam.
Thank you.
Pranam to the listeners.
Thank you very much.